Anesthesiology in under 5 minutes. So there are 4 things you're going to learn in this video. You're going to learn what anesthesiology is, what it takes to become an anesthesiologist, and the 3 different types of anesthesia, along with what is conducted prior to an operation. According to the Cleveland Clinic, anesthesia is a treatment using drugs called anesthetics. These drugs are used to keep the patient from feeling pain during any medical procedures. Anesthesiologists are medical doctors who administer anesthesia and manage pain. Some anesthesia numbs a small area of the body, but general anesthesia makes you unconscious during invasive surgical procedures. Anesthesiologists can specialize in 7 subspecialties: cardiothoracic, critical care, neurosurgical, obstetric, regional, pediatric, and then hospice and palliative anesthesia. There are 3 different ways that anesthesia can be delivered into the body. There are topical, injected, and inhaled, all of which result in a loss of sensation. Although the other 2 versions are popular indeed, topical anesthesia is slowly gaining more popularity. Topical anesthesia generally comes in forms like gels, sprays, creams, ointments, or patches, and are provided to the clinic with precise options for application. Injected anesthesia is usually a one-time injection of medicine that numbs a small area of the body. It is a single dose, and it generally is into the area that surrounds the spinal cord. This version of anesthesia is used for procedures such as performing a skin biopsy or breast biopsy, repairing a broken bone, or stitching a deep cut. Lastly, an inhalation anesthetic is a chemical compound that has a general anesthetic properties that can be delivered via inhalation. They're usually given through face mask, a laryngeal mask, airway, or tracheal tube that is connected to an anesthetic vaporizer or an anesthetic delivery system. In order to practice in anesthesiology, there are 4 different things that are necessary for an anesthesiologist to know: physiology, pharmacology, management of airways and respiration, the use of hemodynamic monitors to measure the blood pressure, and cardiovascular and pulmonary resuscitation methods. Now that you know all the different things that you can do once you are an anesthesiologist, what does it take to become one? In order to become an anesthesiologist, or really any type of doctor, extensive training is necessary. Starting with 4 years of undergraduate, anyone looking to be an anesthesiologist will then need to go through 4 years of medical school. At the end of their 4th year, they must pass the USMLE, which is the U.S. Medical and Licensing Examination, and then undergo 2 to 3 years of residency. At the end of residency, they must, if they so choose to subspecialize, that will then require further certification. But if they are not, then they must complete a written and oral exam from the ABA, which is the American Board of Anesthesiology, and successfully complete it in order to actually practice. The subspecialties of anesthesiology that will require additional ABA certification are critical care, pain medicine, hospice, and palliative medicine. Once they complete all the certifications, they may then start practicing in the U.S. as an anesthesiologist. But if they are not from the U.S. and if they have not undergone residency in medical school from the U.S., they must take the ECFMG. The ECFMG is the Educational Commission for Foreign Medical Graduates. These are for out-of-country anesthesiologists that are seeking a medical degree in anesthesiology for practice in the U.S. This includes a medical proficiency exam, a verification of medical degree, and a language test. There are a total of 3 different types of anesthesiology, and they are local anesthesia, regional anesthesia, and general anesthesia. Local anesthesia is usually topical and injectable agents, and they are given to temporarily block the pain in a very specific part of the body. This is different from regional in specificity. It's generally administered for one time only and used for skin biopsies, stitching a cut, and repairing a broken bone. Regional anesthesia solely contains injectable agents. It's given in the spinal or epidural areas of the body, and it numbs the portion of the body but larger than local anesthesia's area of use. When given regional anesthesia, it is up to the patient to remain awake or be sedated. Lastly, general anesthesia is any agent type that is given either by a mask or an IV line. During general anesthesia, sedation is necessary and the patient will be rendered unconscious, and it usually contains a combination of medicine to give the sleep-like result before a medical procedure. There is one more type of anesthesia, monitored anesthesia care, or otherwise known as twilight sleep. This type is when an anesthesia specialist stays throughout the duration of surgery because the anesthesia amount is that high. Lastly, let's go over what is known as the preoperative. The preoperative is what is done prior to an operation and conducted by the anesthesiologist. A preoperative is the assessment that is administered prior to surgical operation, and it is usually performed by the anesthesiologist in order to sedate and treat the senses of the patient before the surgery. A preoperative first starts with a review of medical history, and then a review of past medical history. This usually contains basic organ conditions of the patient that may or may not have any diseases that are in line. Then they look over past surgery that has been done to the patient, any allergies that the patient might have, medication use, and drug use. And there you have it, a whole overview of anesthesiology, what it takes to become one, and what is done during a procedure. Thank you.